All right, welcome everybody. Thanks for being patient with us this morning. I cannot believe this is the second to last Learning Collaborative meeting this year. I feel like this year just got started. Our team is working on the 2024 agenda for Learning Collaborative meetings, and we are like super stoked about the content we plan to cover. Some of the speakers that we have are going to join us. FYI, that we are going to be tapping the teams to do a little bit more like report outs on how your hospitals are doing. So be prepared with your PowerPoint skills. Because we want to hear from you. But we will go ahead and get started. I'm sure people are going to continue to join us. By going to the next slide, I'll give you guys a little bit of an overview of what we're going to do. We received all your Q3 data. Thank you all teams for submitting. Always appreciate the time and effort you guys put into that. We're going to give you a little bit of update about how the data looks. We're going to give a brief update on how the Moms Plus program is for you guys who both know what the program is, and for those of you who aren't currently involved in the program, we'll give an overview. And then we're going to talk all about disseminating your quality improvement outcomes, a topic that many of us are passionate about. So you're going to hear from a few different team members today about how to do that and what support we're willing to offer you guys for that. And then finally, we're going to give a little preview of what's happening next year with our primary cesarean reduction SOAR learning collaborative that some of you are involved in, but happy to share that our format is going to change in the coming year. So go to the next slide, and I'll turn it over to Gretchen.
Hey everyone, it's great to see so many familiar faces. As Amber mentioned, thank you all so much for submitting your Q3 data. It was really great to see such excellent turnout in that. I did want to say we still had there's still room for improvement in terms of submitting both hospital level and patient level forms, but always appreciate when hospitals reach out. If you're going to be a little bit late in terms of submission, we're very flexible. I'm happy to help in any way that I can in terms of those data efforts. We can go ahead and move on to the next slide. So this is just a little overview in terms of the screening rates for patients admitted for birth. And this includes that blue line, which is screening for substance use disorder. We have anxiety, depression, and then social determinants of health. Really great news, between Q2 and Q3, we saw an improvement in screening for substance use disorder that jumped from 71% to 83%. So great work on that. And then we see that yellow line has sort of trailed down a little bit, but we're still hovering around the social determinants of health screenings around that 61%. So still opportunities to improve, but we're doing really well in terms of screening rates. So congrats. Let's go on to the next slide. Here we have some of the clinical care practices for patients who have screened positive here. And we see that all clinical care practices have improved between Q2 and Q3, except for scheduling postpartum visits, which we'll get to in the next slide. But just wanted to congrats again all the hospitals for really stepping up and trying to improve a lot of these metrics. We'll go on to the next slide. So of course, postpartum is a really important aspect of the clinical care. Every patient with positive substance use should be scheduled for a follow-up prior to hospital discharge. And this just really helps patients not get lost to follow-up care. And so we see that it did trail down just a bit in Q2, or in Q3, but we're still doing really well and getting closer to that 50% mark. So really trying to improve those postpartum schedule rates. Next slide, please. And here we see patients referred to or who are already in recovery treatment. Those who already are in treatment stayed relatively consistent between Q2 and Q3, which is still a really great improvement in relation to previous quarters, ensuring that those who need treatment are not without the referrals and resources that they need. So really great work on that in terms of this past year's data. Next slide, please. And then lastly, I wanted to show a run chart in terms of those who have screened positive, for patients who have screened positive for opioid use, how those MOUD counseling and initiation and referrals are going. Again, we saw some really great improvements in Q3, so great work for all of you doing the hard work and then showing that in your data. So really great improvements there. I'm happy to share any of these charts with you all. At any point in time, you're always welcome to email me, and I'm happy to share this data, both for an aggregate of a cohort, but also for your individual hospitals that you can find on your dashboards as well. Next slide, please. We wanted to go ahead and take this time to mention that we did a small update to our patient level form, which Sydney had sent out last week. And just wanted to draw your attention that we did add a question here, number 11, under the screenings for has the plan of safe care been created for this patient or dyad? And then we have these 3 different options, yes, no, or unknown. So that's just a new question that we added to the patient level form. And just wanted to draw your attention there. Everything else on that form should have stayed relatively the same. There's been a couple of changes in terms of location, but everything else should be relatively the same. If you have any questions, though, by all means, don't hesitate to reach out to myself or Sydney. Everything has been updated in REDCap to reflect those changes as well.
I think Gretchen froze on us. I'll give you guys your data reminders. I hope she comes back to us. We, this quarter, have had more people submitting patient level forms and patients who have screened for cannabis only. And just as a reminder, we don't actually require you guys to submit those forms. You're welcome to still fill out a form for those patients if that helps the clinical care to be given, but submission within REDCap does not need to happen. And so just a reminder, save yourself the time and energy for submitting those into REDCap. If we do receive them, we're happy to kind of let you know that that is happening. We can report that data back to you, but for our purposes, we won't be reporting to you on patients that just screen positive for cannabis. So please don't take the time to submit them because you don't have to.
Thank you, Amber, and I apologize for my internet cutting out. Also, just a quick little note on that last page in terms of those patients that only screen positive for cannabis. You also do not need to include that as part of the total of those who have screened positive on that hospital level form as well. All right, last data reminder is that for the hospital level demographics, we have 2 different sections, one for the demographics of patients that were admitted, and then we also have a separate demographic section for those that were screened for substance use disorder. So this should really include any patient. So the number of those demographics should really add up to the total number of those that were admitted and also those that were screened. Happy to discuss this further if teams have further questions or would like further clarification. But thank you all so much, and I will hand it back over to Amber,
who will actually hand it over to Sydney and or Sarah.
I am actually going to pass it over to Susan to give updates on Moms Plus.
Hello, everyone. My name is Susan Bradley. I'm a pharmacist champion with the Moms Plus program. For those who don't know about Moms Plus is a program focused on establishing a framework for providing treatment and recovery resources to perinatal patients with SUDs out of our birthing units in Colorado. We're in the implementation phase of our pilot right now and actually started having our first implementation meetings with pilot sites yesterday. Our team is really excited to see all of the meaningful progress that our sites have already started making. For those in the pilot, just a quick reminder to head to momsplus.us for all of our resources. We have videos on there, we have order sets, a lot of links to different sites that can also provide you some resources. For those interested in joining Moms Plus or learning more about it, I'd refer you back to the site as well, or feel free to talk to any of the Moms Plus team members. We have all of our offerings on there and can show you what we can provide to your site. And lastly, our team is happy to work with any of our pilot sites on training and providing education to frontline staff or providers. We can call into staff meetings, into OB section meetings, whatever works best for your team. Thank you.
Thanks, Susan. The Moms Plus team and CPCQC has really spent quite a few weeks over the last few months really trying to align our program so that it's one message that's going to you guys. It doesn't seem like 2 completely separate programs. While the goals of the programs are different, we really want to show a united front. And so that's why we have Susan with us today. And a lot of our programming will be braided together in the future, but just a quick little update there.
Okay. So some of the goals for our meeting today is to talk about the importance of disseminating your quality improvement outcomes. And this includes successes as well as major lessons learned. Thank you. Okay, so some of the most important concepts in disseminating your outcomes. First, we need to define our stories. So every hospital story is a little bit different. Their challenges are a little bit different. So first we have to think about what our wins are, what our challenges are, and what lessons have we learned that can be useful for other teams who might be a little earlier in the quality improvement process than your team is. Step 2 would be deciding how you want to share that story. What's the best method? So today we're going to talk about a few of the most common ways that we can disseminate quality improvement outcomes. The first one is conferences. We'll be talking about posters and podium presentations. We'll be talking about journal manuscripts, op-eds, and media releases.
Thanks, Carly. Actually, guys, I jumped first with op-eds because I am here to convince you why healthcare providers need to be writing more op-eds, and to convince you that it's the most accessible non-academic way to distribute your thoughts and your outcomes for quality improvement. And so just to give a little primer here, op-ed stands for opinion editorial. And this is because it originated from the New York Times printout newspaper, if you all remember those. And the opinion page was just adjacent to the editorial page, and that's why it's called an op-ed. More recently, you can sometimes hear newspapers or online outlets calling it like a guest essay or a guest commentary, but they all follow the same general format. Go to the next slide. I, again, want to convince you that as healthcare providers, you should attempt this because a recent study found out that nurses were cited as experts on health-related news stories about 2% of the time. And I know that not everyone here is a nurse, and I think this applies to advanced practice registered nurses, nurse midwives, and physicians as well. But I think healthcare providers in general, and particularly nurses, tend to be underrepresented in the media and have valuable opinions to share. So I want to give you a really quick case study of what I mean by saying that healthcare providers and nurses can have a valuable opinion that they should share. So in 2018, the US government separated families that were seeking asylum at the US border. You guys probably remember this a few years ago. Dozens of parents were being split from their children, and the children were being sent to government custody or foster care, and then the parents were often being detained or sent to jail. A group of nurses understood that this is a traumatic event that can have long-term outcomes for the children and for their parents. So a small group of nurses worked together to quickly write an op-ed to respond to these practices. The authors first identified what the problem was and outlined it for the readers. That problem was that 2,000 children were separated from their families that year. And then they also suggested some evidence-based research on the effects of the separations. Those writers kind of summed it up by proposing some solutions and citing some well-known organizations like the CDC and SAMHSA, organizations that had actually already written clinical guidelines to address these types of issues. The nurses tried their best to address the why of why government officials should be addressing this issue differently than they were. And more importantly, this op-ed was based on a healthcare provider's perspective. So the nurses published that op-ed on the Hill, and that's a newspaper that's mailed directly to all the congressional offices that were published online. The op-ed was shared almost 2,000 times online, and as a result of this, the US senators wrote a persuasive letter to the Secretary of Homeland Security demanding that the children be united with their families, and they were successful. And so to me, I think nurses and healthcare providers have such a valuable perspective on how media events are both portrayed and how governments can be treating people in the United States. And so I think this is a really powerful example about how an op-ed can serve really important purposes, especially for our patient populations. Here's some examples. You guys, I'm sure, have seen some of these. There was a really powerful one just recently about maternal health care in the New York Times. Op-eds, the ones that actually get published, usually share a few characteristics. Typically, they're very timely, meaning that if you're responding to an event or a publication or a media report, you've got to be quick. right? You've got to gather your thoughts, gather your team, and respond usually within 24 to 48 hours to that. News cycles, we know, especially in a political environment, change very quickly, and we'll move on without you. And so op-eds that get published usually are very timely in response to the topics that they're wanting to cover. And then secondly, they usually take a strong stance or make a convincing argument for or against either a policy change, a health issue, or a highly visible news story. But whatever the topic, the op-eds usually have a strong voice or a fresh take that we're not currently seeing in the media. Newspapers are one of the common places to publish op-eds, but of course newspapers are a little less common in print, and so online outlets or online versions of newspapers are where op-eds often get published. They're not long, so we're not talking about an academic research paper here. Usually op-eds are somewhere between 600 and 1200 words, with a kind of a normal average right around 750 words. So a couple short pages, honestly. And so you have to be really smart about how you're using your words and be really concise in your arguments. I recommend having a peer or someone familiar with the topic review it before you submit it, just so that you can think, could I be more concise in what I'm saying? Or am I missing a clear argument that I didn't actually address? You can go to the next page. So again, these are my tips, timely and relevant. I want to remind you that even if you submit an op-ed to an outlet and it's not published, it still serves a really important function, and that's to educate the editorial board, because that editorial board is the ones that are deciding about op-eds who are being submitted and published in the future. And so being turned down for an op-ed submission sometimes feels not great, but it's still worthy try. Because anyone who's willing to read that op-ed still can have their minds changed. HIPAA guidelines still apply. So if you're talking about patient care, make sure that you're being really mindful of not breaking HIPAA. And we really encourage you not to use any medical jargon, right? Think about your non-medical uncle reading your article, right? Someone who doesn't really know the terminology in your field. I usually think about how my sixth grader would read it, and if they could actually read all of the words and understand what I'm saying. And then finally, if you are interested in doing op-eds, follow a couple really important news outlets. Keep track of the stories that are coming out. And if you're thinking, I have thoughts on that story, write them down, share them with a colleague. There's no harm in submitting and getting turned down for an op-ed. And also, op-eds don't have to be New York Times, right? Like, we have many local news outlets that will publish op-eds, especially if it's on a local issue. The Denver Post regularly posts op-eds. In my area, the Boulder Daily Camera puts many op-eds in their newspaper. And so don't think that you have to go big or go home, right? You can talk about smaller outlets or online magazines that you could submit to. The last resource I want to give you here on the next slide is the op-ed project. Their tagline is one of my favorites when you think about op-eds, and they say, whoever tells the story writes history. And I think that's a powerful way about thinking. Sharing your opinion can really impact how history is recorded. And the op-ed projects gives lots of really great feedback on getting started in the world of op-ed writing. If you guys are interested in doing an op-ed, please reach out. I would be happy to collaborate and help you. Thanks.
Okay, now we're gonna move on to talking about conferences. And I know most of you have been at our previous conferences in the past. I see some familiar faces, but conferences can range from small institution-based conferences. Maybe Denver Health has an OBGYN annual research day, all the way up to national and international academic conferences on this topic. And we're going to talk about a few of the most common ways that we could present our information at conferences. First is the podium presentation. When you go to a conference, these are the people who are speaking majority of the time to the entire audience. It's typically a 20-minute to 1-hour talk to a large audience, typically followed by a formal Q&A. There are two ways that you can do a podium presentation. Often these are invited, which means the people that are planning the conference reach out to you, but also it can be by abstract submission. And this is what I want everyone to be paying attention to here. So for those that do have an abstract submission, conferences that are on your topic in your world, noting when they're accepting abstracts, and knowing what story that you would want to tell and how your story would benefit other people. So step one in a podium presentation is deciding that story. It can be a win if your team was able to really effectively introduce a plan of safe care or something to that effect. It could be a struggle. Maybe your team identified that you're having significant issues with getting care for certain racial or ethnic groups. Something like that, a struggle that you've faced. Or it could be a lessons learned, maybe the story of how you overcame some struggles and now would be considered a win. So once you've decided what story that you think would be useful to other people, step 2 would be to find that conference or forum that has an audience who would benefit from your story. So like I mentioned, this might be the hospital forum. It might be a research day at your institution. Most programs with residencies have to do research days, so I wouldn't be surprised if there's one at a hospital nearby. Regional medical or public health conferences. We've got our CPCQC program specific conferences. There are the A1 conferences for nursing. There's medical conferences that are more targeted towards providers. There's public health of the Rockies is one of our local ones here. But really understanding what kind of level of audience you would like to have, how big of an audience or how local of an audience would you like. Next is to submit the abstract, and similar to the op-eds, if your abstract is not accepted, that's okay. It's a really good practice in putting your story into writing, and can always be used for future conferences, even if it's denied. When writing an abstract, you really want to start with the why. Why should the audience care about what you are talking about? And how would your story benefit them? If it's a win, how can they repeat that win? If it's a struggle, how are you addressing that struggle that another team might also be struggling with? Including your data. This doesn't have to be a major systematic review. It does not have to be a huge N. It can be quantitative data. It can be qualitative data. It could be quotes that you've gotten from patients. It could be a discussion of how your healthcare providing team is addressing a topic. It doesn't have to be super rigorous, but we do want to have some semblance of where we're starting and where we're going. You're going to state your conclusion at the end of that, and you're going to end with a big picture. This goes back to the why. We really need to emphasize why other teams should be listening to what you're saying. An emphasis on storytelling. Storytelling is always the way that is going to be more effective to get people to remember what you said. And when we talk about healthcare, having a HIPAA compliant, of course, storytelling can be really efficient in getting people to build the sympathy that you want them to have, or to the buy-in that you want them to have. And then if you have questions, contact the organizers. It might be a little daunting to email the info at blah, blah, blah email address, but they're very responsive. The people who are planning these conferences want people who are invested to speak at them and want people who will draw an audience. And they're usually very, very kind. So feel free to contact the organizers, even if you just have an idea, and say, I have this idea. I'm wondering if it would be a good fit. If it is, would you recommend I submit an abstract? And that's a really good way to see. And they might say, no, we're actually looking more for this type of topic, or whatever it may be. So please feel free to reach out to the organizing body if you have questions. And now we've got Katie and Mick, I believe, to talk about posters.
Hi, I'm Mick Zywick. I was fortunate enough to present last year with Katie Breen at the National A1 Conference. And poster presentations are a little bit like podium, but a lot less. So if you don't want to have the audience that scares you, you can start with a poster presentation. And I feel like getting your data out there, this is work you're already doing for the most part. And it's not hard. So, again, you create an abstract, a brief description of your project. It's pretty easy. And then your data, submit it. There, you're going to give a brief overview. When you're there, it's not like a whole audience. It's kind of like people come in waves, or sometimes one at a time. So it's much more small. and it's very much informal. So a lot of people looking at your poster are doing the same things and they have ideas. So it's like a great time for you to network and learn from each other, because we're all doing very similar things, just a little differently, and getting, some people get better results than others, and learning from each other is very important. Okay, the next slide. You can present your poster to, I feel it's important to present it to the staff, the people that are actually doing the boots on the ground work. Let your staff know, hey, look what we did. This is great data, you know, make them proud, show them what you're presenting. Also at service line meetings, I feel like including your providers, the residents, whoever your hospital has, and give credit to those who are doing the work, right? That's important for these posters. Then you can do a small poster presentation at your hospital, maybe if they have that day, or at a large conference like the national conference or the local conferences. So kind of the same thing. CPCQ has a very, very beautiful template. You can go to the next slide, and they'll help you put it together. We presented on SBIRT and how we utilize our tools to get appropriate referrals to treatment. And we had to be at the poster at a specific time for this national conference, and then just talk about how we accomplished our goals. And like you said, it's very non-threatening. People wanted to hear our data, and they had ideas for us to make more quality improvements in our hospital as well. So it felt like a win-win. And being a collaborative with the CPCQC was amazing, because they helped make it beautiful. I gave them ideas, and Katie created this beautiful poster, or the whole team. I'm not sure who all does that, but
it was it was not me.
It's fun, and it ended up being really rewarding.
Yeah. So just to drive home what Mick said, first of all, we had a lot of fun. So don't forget that part too. It's fun. But yeah, so if you're interested in submitting a poster to any presentation or to any conference, you can feel free to use our template. We linked with this QR code, the template. If you forget where this is or whatever, you can always email us and ask for it. And then we're also, like Mick said, very happy to help you. So if you're like, I want to do this template, I want to do this poster, we will sort of work with you to figure out like, okay, what should the content be? Let's pull your data, whatever. And we, like Nick said, we can help make it pretty. We can help format it for you and help you get it over the finish line in terms of actually submitting the abstract to the conference. And then, we're happy to present alongside you. And I don't want to toot our own horns, but we're pretty fun. So it'll be a good time.
Okay. Moving back to the written communication. I know the op-ed got bumped to the beginning. Now we're going to talk a little bit about some academic manuscripts or journal manuscripts. So I know that academic publishing can be really daunting, and that's okay. I've faced it myself. But what we want to think about when it comes to an academic journal. So if you are going about your day doing quality improvement, you've got some interesting data. Again, it could be a win, it could be a loss, it could be a struggle, it could be a story over time that you're collecting data on, and you think it would be really useful that other teams could follow your example. A journal manuscript might be the right place for it. So step one, when you're thinking about potentially publishing a manuscript, is to review your story and your data with your team. Typically, these are not a one-person push, it's a team. So you really just want to sit down, start gauging who would be interested in this, who has the time to put into writing a manuscript and going through the editorial process, and just start discussing the data and the story. After you've had some of those brief discussions, it's important to decide the best audience for the story. Is it a public health audience that you want to target? Is it a clinical audience? Within a clinical audience, is it a nursing audience, a physician audience, maybe even more niche to be a nursing educator audience or a nursing manager audience? You can really get pretty specific there. And once you've decided who you want to target with your story, you want to start looking into some of the applicable journals and familiarizing yourselves with their guidelines. When I'm doing this, I'm quite literally Googling journals in this field and whichever field it may be, and it'll come up with a whole list. Some really common ones that we talk about are A1, ACNM, ACOG, Public Health, Health Affairs, Addiction Medicine. These are all kind of within CPCQC's wheelhouse. But there's other more specific obstetric nursing journals. The Journal of Midwifery and Women's Health is one that we're in current editorial process with right now. And every journal is a little different on their guidelines. So say you want to write a quality improvement clinical story, check with that journal. It's all on their website. You can look at the types of articles that they accept. And if they have a quality improvement type, then they will provide instructions on the length, the data requirements, and it will also give you information on the cost of publishing and authorship requirements. And that can come in a little later, but something that's important is to talk to your hospital team about what the goals are for the team and how those publication costs can be addressed. Okay, on the next slide, thank you. So the next step, you've kind of done the big brainstorming part. Like maybe I think I would like to submit this as a journal. Next is to build the authorship team. These teams can be as big or as small as you want, and it includes people who are collecting the data, people who are analyzing the data, people who commonly present the data and know how to speak about it, people who are overseeing this program. Maybe you have clinical or public health partners. Maybe you want to work with CPCQC on a publication. Maybe you have peers that are interested in participating. Maybe you have residents on your unit who have to do publishing. Maybe you have students on your unit who are interested in this. This is really kind of the fun phase where you can just start talking and building interest among the people that you want to work with. And then discussing authorship agreements up front. Authorship agreements might change. People might get slammed with work and have to take a step back. People might find that they actually really enjoy the process and want to take a larger role, and that's totally fine. But having a general idea of who needs to be included and who wants to be included will avoid later disagreements. And if you need some help, if this is your first time going through this, most journals on their website have a specific guideline for what qualifies as authorship. And that's typically what you can go off of when you're making this list. Okay, the next step, you've gotten your team together of people that are interested, and now it's time to begin drafting your work. And I say drafting because this is not a one-time process, it's a reiterative process. Split the work between the team members to highlight strengths. If someone loves doing data analysis, let them do the data analysis. If someone likes the storytelling, let them take that role. Drafts don't need to be perfect. This is the stage where you can just put some words on the piece of paper, put it away for a couple days and come back to it. And that's okay. Seeking honest feedback is a big one. We know that sometimes it's hard to give our colleagues honest feedback about things that we might not like. But this is a situation where the end goal for everybody is to have the best publication. So it's not a personal critique. It's just that we all want the paper to be the best that it can be. Unfortunately, a lot 3 times as much time as you think that this process will take. Publishing is slow. It is slow and steady. It can take over a year to go through the publication process. So don't expect this to be really rapid, which can be frustrating at times, but it can also decrease the stress load because it's not something that you have to tackle all at once. And seek guidance from people with experience. This might be us at CPCQC. This might be your unit managers. This might be the residents. This might be the physicians that you work with if they've done this in the past. But typically people who have gone through this process are pretty sympathetic to how frustrating it can be. So seeking guidance when you want it or when you need it is very important. And then finalize submission. Recheck all those journal requirements and submit it. It's an online portal that you get to submit to, and it feels pretty good when you click that first submit. Now on the next slide, thank you. Okay, so once you've submitted, it goes through peer review, and this is the process that can take quite a long time. What happens when you submit? It can either be rejected, accepted, rejected as is, or sent out to peer review. Most journals on their website have specific indicators about what their peer review means. If it's blinded, typically they're double blind, which means the author doesn't know who reviewed them and the reviewers don't know who the authors are, to decrease bias. And once it's gone through peer review, the journal can again deny it. They can accept it with minor revisions, which is typically like text changes. They want you to rewrite, they want you to change some references. They can accept with major revisions. Major revisions is basically like add a whole new section, reanalyze that data, something that'll take quite a long time, or new data collection. And then with your team, you decide how to proceed. If it's minor revisions, I would typically fall into the boat of make those minor revisions and send it back. If it's major revisions, you are not tied to that journal. Maybe you want to submit somewhere else and see if they have a different opinion. Maybe you really appreciate the feedback they gave and you want to address it and you want to do those new data collections. It's important to remember here that peer review can be frustrating because the feedback you get is typically negative because it's what they want you to change. But keeping in mind that the end goal of your reviewers is the same as the end goal of your team, and it's to make the best possible publication that is useful to everybody else. So while it can be frustrating, knowing that on a base level, you share the same goal with their reviewers, even though if they could probably word their responses a little more kindly, you get to then decide how you want to proceed as a team. Okay, so you can resubmit, making those changes, or choose alternative journals. In this situation, similar to what I mentioned about the conferences, be in contact with the editor. I've had situations where they request a revision that I think is completely asinine or not possible or whatever it may be. Contact the editor and explain what's going on, and it may be a miscommunication. If they request data that you cannot have or cannot give or is not HIPAA compliant, tell them that, and they need to understand what these logistic barriers are. Eventually, the next step would be publication with publication fees. And that's a situation that you should be talking to throughout this entire process with your team about how your unit or your group wants to pay for the publication fees. They can vary quite a bit if it's an open access journal or not. And some journals even have no publication fees. So something to keep in mind. And then the last step, once you've published, pat yourself on the back. That's a huge deal. And then disseminate it. If it goes into this journal and no one really knows that it's published, that's not very exciting. So we want to share it widely. Kind of like what Mick said, talk to your team, celebrate it with your team, talk to the nurses on your staff, talk to the other units in your hospital, talk to your team about making a press release, present it at your hospital meeting, if you have like a departmental OB meeting, something like that. And make sure to get it out there because we want everyone to see the incredible work that you have done. Okay. And then a last little note on publications, just something two things that are a little confusing, but can be really helpful as you are diving into the publishing world. The first thing is an ORCID ID. Most journals, if you publish, they will ask you for your ORCID ID. If you just Google ORCID ID, it'll come up with the form. It ties your name to an ID number. And so that way, if you change your name, if you get married after publishing one paper and before publishing another, or if you just change it, that way you don't get lost in the authorship world and they can continue to tie all your papers to one location. And just like in ORCID ID with Google Scholar, yes, you can look for academic articles, but you can also house all of your publications in one world. So someone can go on and type Sydney Comstock Google Scholar, and it'll pull up her page with all of the publications that she's been involved in. And that can be really helpful as you are making this progress in the QI world, because maybe someone really likes the way your team did one thing and they want to see what else you've done. So they can look at those authors. Okay, and now I'm kicking it to, is it Kylie?
It'll be me.
It's Sarah. Okay.
Yes.
Kicking it to Sarah.
Thanks, Carly. So a lot of what was already covered with op-eds, journals, and presentation also apply to press releases. A press release or media release, plain and simple, allows you and your hospital to brag on yourselves to the community, to patients, to leadership. It's a great way to show your community the amazing things that you and your team are doing to keep pregnant and postpartum people safe. So when is a good time to create a press release? A press release can be written with your unit. If you're hosting an event like a community baby shower, it can either be written before the event to elicit community excitement and attendance, or it could be used to highlight a successful event you've had recently. This is usually written immediately after the event. After a week, it's been too long. It's not worth it anymore, probably. You could also create a media release when you implement a new patient care model. So for example, when you enroll in a CPC-QC QI initiative or implement Eat, Sleep, Console, or previously back to COVID times when you were restricting visitor access to your unit. These are great opportunities to show the community you're always updating practices to better serve their needs and keep them safe. Next, writing a press release to address emerging hot topics. Oh, sorry, the other slide. Thank you. So very similar to op-eds, but this one will be fact-based. So increases in congenital syphilis have recently hit the national news cycle again. So writing a press release to explain what you and your facility are seeing on a local level and how your hospital is addressing this issue through prenatal screening and treatment would be a great idea. This will enable you to address the local community's concerns before the media comes to you asking questions. You could also write a press release if you or someone on your unit won an award or publicized in a publication or spoke at a big conference. Tell the world. People want to be proud of their local community and their hospital. And finally, if you are interested in requesting new volunteers, if you are implementing Eat, Sleep, Console and create or revamp a cuddler program, write a press release highlighting that change in your newborn care practices and highlight the need for volunteers to cuddle those babies. This will show your community you're updating care practices, but also providing them with an opportunity to get involved. Next slide. So again, very similar to what we've already covered, we have the 5 W's: who, what, why, where, and when, and also how. Do you see a trend throughout this presentation as far as information sharing? So continuing with that Eat, Sleep, Console example, what happened? Our unit implemented a new patient care model called Eat, Sleep, Console. Who participated in this change? Highlight those champions who spent hours dedicated to this work. And also highlight those who were on your planning committee. Was your hospital leadership involved? Next, why did you implement Eat, Sleep, Console? Because ESC is a better way to care for newborns who were exposed to substances during pregnancy by reducing pharmacological treatment and decreasing length of stay. Next, address where this took place, at your hospital in your specific unit. When? Let's say this new policy went into effect November 1st. Make sure that's very clear and when it started, but you could also call out the amount of time that you and your team spent creating this implementation plan. And finally, how did you do this? Make sure you highlight that you pay attention to emerging best practices and stay up to date on research. That you created new policies to better care for your patients, you collaborated with other units, trained staff on these new practices, created new patient safety education to explain ESC and highlight the family's role in this new care model. But you could also create one and mention that you created that new cuddler program. And finally, be sure to include your PR department before you contact the media with your draft. A lot of times they have specific templates or requirements unique to your hospital. The PR departments are also usually the ones with the connections to local media and will be responsible for sending the outlets your final copy. And finally, while press releases have a general format and formula, make it fun and interesting and engaging for readers. Create a headline that is clear, but also catchy. You want local media staff to want to read this article. Remember, they are the gatekeepers to getting this content out to the public. Make sure you include quotes from staff who work directly on the project or those who led the initiative. Include pictures where applicable. If you had a successful community baby shower last weekend, include pictures of the event showing the size of the crowd or the giveaways attendees won. Like Mick showed earlier, if you presented a poster at a conference, make sure someone takes your picture to highlight that later as well. And while making it interesting, remember to just include the facts. No opinions, no jargon, no acronyms or fluff. And finally, be camera ready. If and when the press release is picked up by the media, local news channels may also reach out to your PR department requesting to tape an interview or take pictures for print. If you are interested in learning more about press releases, please don't hesitate to reach out to me. Or if you want someone to look over your draft, I would be happy to do that as well.
If anyone needs any additional resources, again, these slides will be sent out to everyone. These are links for additional resources, and then y'all can always email us whenever you're looking for something specific or you need some specific help. And then finally, as we sort of begin to wrap up our coaching call today, I want to thank you all for coming. Sharing knowledge is super important, and addressing the public is critical in doing the work that we do. And so finally, we are revamping our SOAR initiative. We realize this is a SUD meeting, but just to give a little shout out to SOAR, we are revamping this initiative. We talked to IHI and we're switching to a whole learning collaborative model. We're really excited about this. So we're going to have 2 cohorts, a sustainability cohort and a learning collaborative cohort. We want everyone to be as engaged and excited about this as we are. And so here is the QR code. If potentially your hospital is just working with SUD right now and is interested in SOAR, it's our cesarean reduction bundle. I'll leave this QR code up for a second. And then if you have any questions, please reach out to CPCQC. There's more information on our website. And then additionally, another fun QR code for you all. I'm sure some of you heard about our perinatal SUD stigma and bias training. If you're interested in us hosting more of these, there's this QR code as well. It leads to an interest form. We'd love to hear from you if you would like to see more of these happen. And then finally, in December will be our last coaching call of the year. And really, we're just going to have it to celebrate you all, talk about yearly awards, and just updates around the SUD program as a whole. We'd love to see you there. Please send pictures of your team. We would love to have those on file and share those out widely in our newsletters as well. Any questions? There's no questions. I'll leave up our contact slide. I know we just threw a lot of information at you, so feel free to reach out to me, Sydney Comstock. I'm sure you all get many emails from me on the daily. Or just look at our website. There's a lot of information there as well. So thank you all so much for coming. We really appreciate you attending these coaching calls. And we're really excited to celebrate you all in December at the next one. The next and final one, I should say. We can let you all go a whole 7 minutes early, which I feel like is very exciting.